bottle jaw and the causes and differential diagnosis. Let me show some pictures of the sheep and goat which we are having with the bottle jaw. So this is the condition where we can see swelling under the jaw region. So that is bottle jaw. Bottle jaw is a condition where there is accumulation of fluid under the skin in the intermandibular space, and that is the space between the two arms of the lower jaw. So this is abnormal accumulation. Normally, we don't see any accumulation of fluid, or there is no puffiness in the jaw, under the jaw. But here there is abnormal accumulation of a clear fluid, edematous fluid under the skin. So this edema, it may be generalized or it may be localized. So generalized edema, definitely there is bottle jaw. And if it is a local edema, and if there is no edema or no perivascular fluid accumulation in other parts of the body, then there may be some regional problem which is not bottle jaw. So edema, it is caused by reduced oncotic pressure. Oncotic pressure means the amount of solutes which are normally present in the vascular space that holds a certain amount of fluid in the body, certain amount of water in the intravascular space. And when this oncotic pressure is reduced, the oncotic pressure may be because of the proteins present in the blood, they may be because of the cells present in the blood, and they may be because of certain electrolytes present in the blood. And all these things, they hold the fluid in the intravascular space, and they maintain the blood pressure, and thus the fluid, it runs inside our body. So if there is any condition where there is reduced number of cells, where there is reduced amount of protein or electrolyte in the intravascular space or in the body, in that condition, there will be oozing out of the fluid, because there will not be sufficient amount of electrolytes or sufficient amount of particles which will hold on to this fluid. So there will be oozing out of the fluid from the intravascular space into the extravascular space, and that gets accumulated under the skin in the subcut region. So in case when there is excess loss of blood, when there is hypoproteinemia or certain conditions where there is reduced amount of particulate substance in the blood, this fluid, it oozes into the subcut tissue, and it is present throughout the body in the subcutaneous tissue. So this causes disruption of the normal balance or the pressure inside the intravascular space. And this pressure, actually, as I said, it is maintained by protein and certain particulate substance inside the vascular system. And this, when there is reduced amount of this, there will be accumulation of fluid in the interstitial space. And this can also be caused by, as I said, if it is generalized, then it is edematous body. And if it is localized, it may be because of some pressure, local hydrostatic pressure, or in the submandibular region, like if there is accumulation of fluid in the lower jaw, that may be because of blocking of the lymph drainage in the submandibular lymph node, or that blockage may also be because of certain thorns or certain grass seeds which block the lymph nodes, or which even block the salivary gland. So this is not true bottle jaw. Again, I'll come to the bottle jaw. So it is seen mainly in the sheep and goat, and it may also be seen in case of cattle also, and particularly in young calves. The causes may be infectious or non-infectious. Now, infectious cause, as I said, there will be reduced amount of blood in the intravascular space. This reduced blood or reduced protein may be because of certain elements. Now, what are these reasons because of which there will be reduced amount of cellular component or protein or electrolyte? So, liver fluke is one of the important cause of bottle jaw. Chronic liver fluke infection, it actually causes liver infection. It causes, since the liver is very affected, so what happens? There will be reduced amount of protein synthesis. So again, the oncotic pressure of the blood and the intravascular space, it is reduced, and that will lead to oozing out of the fluid from the intravascular space to the interstitial space. There are other worms also, like Haemonchus contortus, and it is commonly termed as barber pole worm in sheep. So Hemangos contortus, it actually it attaches to the intestine, it attaches to the gastrointestinal tract, and it sucks the blood. So there will be continuous oozing out of the blood from the area where these worms they attach themselves and they suck blood and they leave a bleeding border. So there will be continuous amount of blood loss from the small areas. Pinpoint hemorrhages there will be there, and if this worm load is too high, then there will be again anemia. Jones disease is it is also a chronic wasting disease, and it is caused by a bacteria. So here, what happens? The intestine, the large intestine, it is getting affected where maximum amount of absorption assimilation is done. So that portion of the intestine is affected, and the absorption is reduced. So absorption of all the nutrients from the food taken in, that is hampered, and this will lead to a reduced amount of nutrients in the body, and that again leads to reduced amount of protein and other substances in the body, and that leads to hypoproteinemia. Again, there will be a reduced intravascular oncotic pressure, and that will lead to edema. Now, again, if as I said, in case of Jones disease, there are certain other diseases also, or certain other conditions where the bowel is chronically inflamed. That also causes reduced amount of absorption, and hence assimilation is hampered, and then that will lead to reduced oncotic pressure. Hemolytic anemia. There are certain diseases, certain conditions where there is hemolysis, intravascular hemolysis. So that may be because of any bacteria, that may be because of any blood protozoan parasitic infection, or there are certain other conditions where there is hemolytic anemia. So one important bacterial disease which leads to hemolytic anemia in case of sheep and goat, that is Clostridial infections. Again, the Clostridial infections, as I said, liver fluke, when it is present in the animal, it affects the liver. The immature flukes, they traverse the parenchyma of the liver, they will traverse the bile canaliculi of the liver, and they will cause damage to the liver. And here, when this is damaged, the Clostridial infection, which is always present inside the body, that will get a chance to grow there, because these liver flukes, they will create necrosis, they will create an anaerobic condition, and anaerobic condition is very very favorable for clostridial infection to develop. So these clostridial infections, they will develop, and they will lead to hemolytic anemia. One important clostridial disease is bacillary hemoglobinuria. That is also a disease where there will be loss of hemoglobin. Leptospira is also one of the condition where there is intravascular damage, and that will lead to the oozing out of the blood, and hence anemia. Again, coccidia. Coccidiosis is also very common in case of all the animals, including the poultry. So coccidia also, it affects the intestine. Different parts of the intestine are affected by different species of the coccidia. So here also, these coccidia, they will cause denudation of the mucous membrane of the intestine, and that will leave a bleeding border of the intestine. So that will again cause loss of blood. Then there are certain blood protozoan parasitic infections like Babesia, eperithrozone, which is very, very common in case of sheep and goat. And again, internal parasites like amphistomes, strongyles, then trichuris, etc. There are certain, these are the infections which will cause continuous bothering to the duodenum, the intestine, and then they will lead to loss of blood from the intestine. Then ectoparasites, very, very common in case of sheep, goat, and ruminants. Ectoparasites also, they keep on sucking the blood, and this will lead to anemia. And all these factors which will lead to anemia, they will lead to reduced intravascular oncotic pressure, and that will lead to edema. Now, there are certain non-infectious causes also. So traumatic anemia, again, there is any trauma to the animal, there is lot of blood loss, and that will lead to anemia. Then there are certain conditions where there is reduced erythropoiesis. Either they are autoimmune, or they may be because of certain deficiency of certain elements or certain enzymes, where these enzymes, and where these elements are being used as a substrate for the enzyme formation, and thus there will be anemia. Again, malnutrition, low protein diet. This will also cause reduced oncotic pressure. Phosphorus deficiency. Phosphorus deficiency, how it causes hemolysis? Because phosphorus is an important part of the cell membrane. So when there is reduced phosphorus, the cell membrane integrity will be damaged. Similarly, the cell membrane integrity of the RBC is damaged, and there will be hemolysis, and this will lead to again anemia. Again, phosphorus is a part of many enzymes, and ATP, as we say, ATP, it is the ultimate source of energy. While ATP formation also, phosphorus is required. When there is deficiency of phosphorus, this ATP will not be generated, and this will lead to reduced energy level throughout the body. And now again, I'll come to the congestive heart failure. Because there is reduced amount of energy in the body, so the heart will also not get enough ATP for the proper functioning. So what will happen? The functioning and the contractility of the heart is hampered. But again, all the tissues are demanding blood, they are demanding nutrition. So this heart has to work very hard. And again, it is not getting enough energy. So a time will come when this heart, it is trying to give its full energy efficiency, but it is unable to function because of deficiency of energy, and this will ultimately lead to congestive heart failure. Now, copper, excess copper and reduced copper both cause rupture of the RBCs. There will be a rapid onset of the anemia, and there will be acute death. In copper toxicity, this is actually very common in case of sheep, and rather than in case of goats. Now, since goats can tolerate the excess copper in a better way than sheep. So, while we are preparing feed mixes in case of animals, especially in case of sheep and goat, this point is to be taken into account and kept in mind while feed formulation, that how much copper is to be substituted in the feed. So, again, low cobalt, low selenium, or high molybdenum. High molybdenum, actually, it causes, even if the copper is in sufficient amount, but if there is an excess of molybdenum in the soil or in the feed, that will not help absorption of this copper. So copper is in normal or optimum level, but the molybdenum is not in optimum. Molybdenum is in high level, so it will actually hamper the absorption of the copper. So there will be deficiency of copper. Then again, excess iron, sulfur, all these cause nutritional imbalance, and they actually cause an enzymatic imbalance, and that will help, that will actually cause a imbalance in the oncotic pressure and imbalance in the enzyme system and in the systems throughout the body. So that will lead to reduced amount of absorption, reduced amount of certain electrolytes, and this will lead to reduced oncotic pressure in the blood, and that will lead to edema. Again, as I said, a certain mineral imbalance that could lead to anemia, and again, and copper problem. Actually, as I said, copper deficiency or copper excess is more common in case of sheep and goat. Certain plant toxicities like kale plant or brassica plant, they are also causing anemia. Actually, they cause hemolytic anemia in case of goats, and that will lead to reduced oncotic pressure. Then increased blood pressure in the veins, and that will lead to burst opening of the veins, and that will lead to excess amount of blood loss in the peripheral tissue, and that will lead to reduced amount of cellular and solute portion in the intravascular space, and that will lead to oozing out of the fluid. There is a special condition known as milk goiter. I will show you the video. Milk goiter is sometimes said, or it is mistaken like bottle jaw. There is a swelling in the submandibular region in case of young lambs and kids. And these kids are newly born, 15 to 1 month of age, and they will have a good swelling in the submandibular region, and that is many times confused as a bottle jaw condition. But that is not bottle jaw condition. That is a uh, increase in the size of thymus gland that is seen in certain breeds and certain lines of the goat and sheep. So that we have to differentiate. Now, epidemiology, season wise, we have to see again while diagnosing, we have to keep this in mind that whether it is a liver fluke infection, because liver fluke is very common in winters and spring, and hemonchus it is seen in autumn, in summer, and again as I said, age. So milk goiter, again as I said, we have to see the age also, what age is affected, and then we have to come to a conclusion whether it is a bottle jaw condition or not. Now, clinical signs. Uh, edema, as I said, it is generalized in the body, and it is more obvious in the lower jaw region, because this is a part where it is obvious. The edema is very obvious. So we can easily make out. So when we touch the swelling, it will be cool, it is pendulous, and it is pitting. So this is important. Edema, always it is pitting swelling under the jaw. Then you have to see for whether there is any parasitic infestation or whether there is any disease. So we have to see if it is multiple animal affected, then certainly we have to see whether there is a common problem or whether there is a certain bacterial infection or certain parasitic infection. And if it is one or two animal, then it is a sporadic case, and we have to treat the animal accordingly. Then other signs are like the animal will be ill thrift, there will be diarrhea, and if in case of hemonchus, diarrhea is not that common. In case of hemonchus, the feces will be rather very dry, very hard, and the feces will be of dark colored. So in hemonchus and in liver fluke, there will also be profound anemia. As I said, anemia again because of the liver affection and because of blood loss. And when you go to check the visible mucous membrane, they will be very pale or they will be white or yellowish in case of liver fluke infection, or in case of jaundice where there is hemolytic anemia, mucous membrane of the conjunctiva that will be yellowish with yellowish discoloration. So there is a FAMCHA chart or card available with which we can hold the card against the visible mucous membrane, particularly the conjunctival mucous membrane, and then we can compare and we can say what is the percentage of anemia in that animal. Then, since there is anemia, so animal will have exercise intolerance. And again, there will be dark, dry feces in case of hemonchus, as I said. If it is a deficiency of copper, then the signs will be a little different. The animal will show poor appetite. There will be slow growth rate, and the hair color of the animal, it will be faded, and the coat will also be very dull. The fleece of the sheep will be very poor, and that will be not of good quality. Then there will be a musculoskeletal problem. The animal will walk with a uh, in coordinated movement. There will be sway back, and all these symptoms will be seen. And if there is copper excess or copper toxicity, the signs will be sudden or severe weakness. Here, in case of copper deficiency, the signs will be progressing slowly, but in case of copper toxicity, the signs will be very sudden and they will be very severe. And there will be sudden depression. The animal will show sudden depression, and again, there will be anemia, and that will be very rapid or very peracute or acute anemia, and the animal will die suddenly. So, as far as diagnosis is concerned, how we will diagnose? So, we have to take the history, whether one animal is affected or multiple animals are affected. This will be one. Then, season of affection. Then, we will see whether that particular area is full of worms, or the animals are left for grazing, and the intermediate host, or like in case of liver fluke, snails and all, they are there. So intermediate host is available or not. or whether there are some parasitic infestation in that particular area, which is very, very common. All these history we have to collect. Then we have to see the symptom of the animal, the color of the visible mucous membrane we have to check. We have to check the color of the visible mucous membrane, whether the mucous membrane is anemic or icteric, likewise. And again, we have to go for the CBC, and in CBC, we have to estimate the hemoglobin, and we have to estimate the PCV. There will always be reduced hemoglobin, and there will be reduced HCT or PCV values, and RBC count will also be reduced. And again, if we have to go for ruling out the parasitic infection, then we have to go for examination of the fecal sample. We have to collect the fecal sample, and then from the fecal sample, we have to go for identification of the egg, and also we have to monitor the fecal egg count. Then nutritional evaluation of feed is also very, very important. We have to see whether there is an excess or shortage of certain mineral in the feed. So accordingly, we have to balance the feed of the animal to rectify the condition. Then, if we find certain animals dead, we can go for post-mortem examination, and we can confirm the case from the post-mortem lesion. So this is again a case, a photograph of a goat with bottle jaw. Here we can very clearly appreciate the swelling under the lower jaw. So this is the Haemonchus contortus worm and the egg. So this is a liver with fasciola of infestation. This black thing, you can appreciate that this is the migratory tract of the immature fluke, and wherever the liver fluke, the immature worm has fluke has migrated, it leaves a bleeding border, and there will be dark color discoloration of the liver. So after fecal sample examination, we can appreciate the liver fluke eggs. So differential diagnosis, as I said, we have to differentiate between certain conditions like jaw abscess. Earlier also I said, because of certain obstruction in the salivary gland, and because of obstruction of certain lymph nodes, there will be a regional swelling in the jaw region, and that may be mistaken for bottle jaw. Again, a condition known as lumpy jaw. Here also it is because of actinobacillus, actinobacillosis. So it is very common in case of cattle, and it is also seen in case of sheep in certain areas. So this is also mistaken with the your uh, bottle jaw. Again, wooden tongue, that is also there, and blockage of salivary gland. Milk goiter, as is seen in case of young kids, that is very common in case of goats. So that is mistaken again as bottle jaw condition. So see, here you can appreciate a goat kid with recently this kid, it came to our clinics, and this was a typical case with a swollen submandibular region. When we palpated, actually it was mistaken for some lymph node enlargement, and this the goat had doe had three kids, and one died, and all three kids they had this condition, and one kid it died, and two kids they had this. So we palpated the condition, and when we saw that there was no pitting edema, and the swelling was like movable swelling, and when we inserted the finger in between the two lobes of the of the thyroid gland, it separated. So it was very, very clear. So here I wanted to show you this thyroid gland, and this there was swelling, this thymus gland, and sometimes there is enlargement of this extension and enlargement of the thymic region also. So this was the condition we here appreciated in the goat kid in our clinics. So it was a very typical case. So see, it is just looking like a bottle jaw condition in the submandibular region here. Again, you can appreciate that but it was a very, very big load. And this actually, we don't need any treatment. It subsides over time. It will take about 4 to 5 months or 6 months time, and the swelling will regress. So treatment will depend upon the cause of the bottle jaw. As I said, uh, typically it is because of flukes in case of sheep and goat, and also in case of cattle. So enthelmintic, we can use enthelmintic. Macrocyclic lactones we can use, glucosides we can use, and ivermectin also we can use in case of Haemonchus contortus. The vitamin B12 deficiency can also cause to anemia, lead to anemia, and we can give vitamin B12 injections. And then iron supplement we can give orally also and parenterally also. Oral supplements, they do not give good results, but definitely parenteral supplements or intravenous, intramuscular, we can use, like dextran and all, we can give. And we can rectify the feed if there is any deficiency of mineral in the feed. We can replace that deficiency, or if there is an excess, we can balance it. Then, in case of severe blood loss, when this anemia becomes non-regenerative, in that condition, we can also go for blood transfusion. But before going for blood transfusion, we have to clear that whether it is a non-regenerative anemia, or whether there is a chronic blood loss, or whether there is an acute blood loss, and we can go for that. So triclabendazole we can give at the dose rate of 10 to 12 milligram per kg body weight orally, or clorsulan that can be given at the dose rate of 7 milligram per kg body weight orally, or if we want to give subcut, the dose rate is 2 to 4 milligram per kg body weight. Rifoxanide, that is also 10 to 15 milligram per kg body weight orally. If it is a mature fluke, we can treat with oxyclosanide 10 to 15 milligram per kg body weight orally. Supportive therapy, definitely in case of liver fluke, we can go with liver tonics and hematinics. In case of Haemonchus, the treatment will be ivermectin at the dose rate of 200 microgram per kg body weight subcut. We can also give tablets orally at the dose rate of 200 microgram per kg body weight. This can also be extended up to 3 times the dose rate, up to 600 microgram per kg body weight. Levamisole at the dose rate of 7.5 milligram per kg body weight orally. Fenbendazole can also be given 5 to 10 milligram per kg body weight. Then oxfenbendazole can also be given at the dose rate of 5 milligram per kg body weight. Supportive therapy, liver tonic and hematonics. Hematonics can be given. Now, how to prevent bottle jaw condition? Regular deworming, it is very, very important. And regular deworming with the correct medicine and in the correct dose rate, because many times the dose rate is not proper, it is underdosed, and then this will cause resistance to the worm, and that will not in subsequent times, if we give the dewormer, the worms will not be acted upon by the drug, and that will cause resistance. So this is one of the important major problem in controlling the worms. Then control of the intermediate host. As I said, in case of liver fluke, snail is the intermediate host. So instead of hitting the animal with the medicine, we can control or we can hit the intermediate host. So copper sulfate can be sprinkled in the area where there is excess snail population. So that is a very good practice. We can also go for simultaneous treating of the soil, treating of the water bodies where these snails are present around the water bodies. We can sprinkle copper sulfate, and we can also simultaneously treat the animal, so that there is a holistic approach of treatment. Then zero grazing, that is these days uh, it is seen that zero grazing, it will prevent the ingestion of the infected stage of the worms, and we can stall feed the animals so as to control the parasitic infestation. So this is all about bottle jaw condition.